Glucose transporters. Now, what are these glucose transporters? So, the carbohydrates they get mainly absorbed only in the monosaccharide form. So only the monosaccharide form of carbohydrates they get absorbed. So for example, if we take glucose, this glucose, this is the intestinal cell and this is the intestinal lumen. The glucose from the intestinal lumen will enter the intestinal cell through the help of a special transporter called as SGLT transporter, that is sodium dependent glucose transporter, which is present on the intestinal luminal surface. Now the glucose that has entered the intestinal cell will reach the capillary surface through a special transporter called as glucose transporter. So this is the glucose transporter. This type of transport mechanism is a facilitated diffusion through which the glucose from the intestinal cell will reach the capillary or the blood vessels. Now, there are 6 types of glucose transporters which are named in the order of their discovery. And there are GLUT1 to GLUT5. GLUT6 is not there, which was a product of pseudogene and was not functional. And next GLUT7 is there. So there are 6 GLUT transporters, GLUT1 to GLUT5 and GLUT7. So firstly, GLUT1 is present in most of the cells. It is primarily responsible for uptake of glucose during fasting. So most of the cells like brain, red blood cells, kidneys and also in the placenta. So mainly responsible for uptake of glucose during fasting conditions in these tissues. Next, GLUT2. GLUT2 is present in the intestinal epithelial cells, in the liver cells, in the beta cell of pancreas and also in the kidneys. This has high Km for glucose, that is it has high absorption capacity for glucose, and this GLUT transporter senses high glucose concentration in the circulation and stimulates the beta cells to release insulin. So whenever there is a high glucose concentration in the circulation, this glucose concentration will be sensed by the this is, for example, if this is the pancreas, and this high glucose concentration is sensed by the GLUT2 transporter, and this GLUT2 transporter will stimulate insulin so that the glucose that is present in the circulation is absorbed. And then it also enables pancreas to monitor glucose level and adjust the rate of insulin secretion. So based on the amount of glucose that is present in the circulation, GLUT2 also monitors or adjusts the rate of insulin secretion. And it signals liver. This glucose transporter, this is also present in liver as we have seen. So the glucose transporter, when there is high amount of glucose in the circulation, the glucose transporter will signal the liver to take up the glucose and stimulate glycogen formation. And it stimulates glycogen formation when blood glucose level is high. So that is about GLUT2 transporter. Next is GLUT3 transporter. This is present in neurons, brain, placenta and testis. We can easily remember GLUT3 present in neurons and brain with the help of the R. R is present in 3. Brain also R is present, and neurons also R is present. So we can remember GLUT3 is present in brain and neurons, and it helps in the transport of glucose especially into the brain cells. GLUT3, whenever there is in circulation, when there is more of glucose, this glucose will be transported to the brain with the help of this GLUT3 transporter. Next, GLUT4, this is present in skeletal muscle, cardiac muscle and in adipose tissue. 4 is present in all the types of muscles, especially skeletal, cardiac and the adipose tissue. This is under the control of insulin. The secretion of GLUT4 is under the control of insulin. So this insulin, so whenever, for example, if we take this as a skeletal muscle cell, if we take this as a skeletal muscle cell, so generally the GLUT4 is present on the inner surface of the cell. So when insulin is secreted by the pancreas, these cells will have a receptor, and insulin will come and bind to this receptor. When insulin comes and binds to these receptors, there will be translocation of this glucose transporter from the intracellular surface to the cell surface, from the intracellular place to the cell surface. So insulin promotes translocation, that is the movement of the GLUT2 from the inner side of the cell to the cell surface, and thus it increases the glucose uptake. So this glucose that is present will be taken more into the skeletal muscle. Once again, repeat. If we assume this as the skeletal muscle or the cardiac muscle cell or the adipose tissue cell, this GLUT4 is present on the interior side of the cell. Now in the circulation, when there is glucose present in the blood, this will be sensed by the pancreas, especially the GLUT2. Now this pancreas will release insulin. Now this insulin will come and bind to the receptors that are present on the cell surface of these skeletal muscle and cardiac muscle. Because of binding of this insulin to these cell surface receptors, the GLUT4 will translocate, that is, it move from the interior of the cell to the cell surface. So because of this translocation, the glucose will be absorbed by the skeletal muscle, cardiac muscle and adipose tissues. So what happens in type 2 diabetes is this GLUT4 is reduced. The number of receptors or the number of the GLUT4 transporters is reduced, leading to insulin resistance. So even if insulin is present, this GLUT4 is absent, so the amount of glucose will be high in the circulation. Even though insulin is present, even though it is not being able to act on the tissues, so which causes increase in glucose in the circulation. So that is what causes type 2 diabetes muscle, especially type 2 diabetes mellitus, especially because of insulin resistance in muscle and in fat cells. So in diabetes, the entry of glucose into the muscle is only half of the normal cells. Coming to GLUT5, this is present on the mucosal surface of small intestine, sperm and kidneys. GLUT5 especially helps in the transport of fructose. This is again, if we see this is the intestinal cell, and this is the intestinal lumen, and this is the capillary surface. Glucose enters through the SGLT transporter. This is SGLT, and here again there is GLUT. But for fructose, there will be GLUT5. So directly there will be GLUT5 present, which helps in the fructose absorption. So in the mucosal surface of the small intestine, in the sperm and in the kidneys, there is GLUT5 which helps in the transport of fructose. We can remember F for 5 and F for fructose. Lastly, there is GLUT7 which is present in the liver endoplasmic reticulum. This helps in the transport of glucose from the endoplasmic reticulum to the cytoplasm. So if we suppose this as the liver, and here if there is endoplasmic reticulum, from the endoplasmic reticulum through the in the liver cell, in the hepatocyte, from the endoplasmic reticulum to the cytoplasm, this GLUT7 helps in the transport. So this is about different types of GLUT transporters. GLUT1, it is present in most of the cells. GLUT2, GLUT3 is present in neurons and brain. GLUT4 especially in the cardiac muscle, skeletal muscle and adipose tissue. GLUT5 specially for fructose, and GLUT7 specially in the liver endoplasmic reticulum.